So in developing this strategy, it was quite frankly a daunting task. You know, I told you we had all these meetings, we got lots of ideas, and there's this feeling I'd have sometimes, it's like, how can I satisfy all these people? One of the things I've said over and over is that this wasn't going to be a catalog, that this is not saying, these are all the things we need to do as a country. I start from this, I think we all start from this idea that we're doing a lot of things right, and we're really building on success. So this strategy doesn't go into detail all the great things we're doing. And also, I think it's strategic to the extent it's short and concise. So we didn't want to get into this idea, am I doing something here to make this group happy, and we really tried to say, in each area, the President's 3 goals, what are the small number of steps we need to take to really sharpen our response to the epidemic? So we came up with just a couple in each of those areas. So to reduce HIV incidence, we have 3 big takeaways. We think that we need to intensify our prevention efforts in communities where HIV is most heavily concentrated. And by that we mean that we think too often we've sort of acted as though we have a generalized epidemic in this country when we know that we actually have multiple concentrated epidemics. And we need to really focus our resources in the communities that HIV is hitting hardest. We also think we need to expand targeted efforts to prevent HIV using a combination of effective, evidence-based approaches. And this is the idea that, you know, if you reflect back to the last decade, couple decades, sometimes when we talk about prevention, we've taken almost an overly simplistic approach. Sometimes there have been debates, do condoms work or don't they? You know, is there some magic vaccine on the horizon or isn't there? You know, is it worth it to educate people? And it just felt like monolithic. And we think we need all of these things, and we need to be strategic in how we use them. So what we're really trying to get to is that we need to find out what works and really rely on evidence, but figure out how to put the pieces together. And when we recognize that we focus on specific communities, the combinations we need will vary. You know, so what we do for Latinas may be very different than what we do for gay youth, for example. And we need to, I think we have some ideas of what works, but we need to really focus on developing better evidence. The third key area there is that we need to educate all Americans about the threat of HIV. So as we focus on as we focus our efforts in the communities where it's most heavily impacted, all Americans need to know about HIV and how to prevent it. So the next big goal is what are the steps we need to take to increase access to care? And there's 3 here. And again, I hope all of you see yourselves in all parts of the strategy, but this is an area where I think hopefully you'll have your own ideas and really can contribute a lot. So in increasing access to care, I would say that building on what Deborah said, the Affordable Care Act is a huge thing. It's going to do more than anything we can possibly do in an HIV-only way to expand access to care and make health insurance coverage more secure for people with HIV. So building on that, we have 3 steps. We need to establish a seamless system to immediately link people to continuous and coordinated quality care when they're diagnosed with HIV. Now there's a lot of elements there, but to sort of simplify it, I think we've done a lot recently to scale up testing, and that's really important. But we think we're falling behind. I really need to. The next step now is, as we scale up testing, how do we make sure that when we diagnose people, we're immediately getting them into care and keeping them in care? The next step is that we need to take deliberate steps to increase the number and diversity of providers of clinical care and related services for people with HIV. Now, part of, as I talked about this, I said, our workforce is under stress. We're going to greatly expand insurance coverage. So that's the challenge we face already. Then you add on the layer of HIV. We know that we have an aging workforce. We know that we're challenged already in the workforce we have. And that's true, but as I was sitting up here, I was like, okay, so when was the golden era? When did we ever think we had the inadequate HIV workforce? When did we think that, medical students in droves just wanted to practice HIV medicine? So this isn't a new challenge, but we do think going forward, if we don't specifically focus on these workforce issues, we're going to miss the opportunities the Affordable Care Act presents us, but we're also going to fall behind, and we can't let that happen. The third key goal here is that we need to support living with HIV with co-occurring health conditions and those challenge meeting basic needs such as housing. So we need to recognize that HIV exists in people's lives that have other challenges as well. We need a more holistic approach. But also, if we're going to meet their clinical care goals, we need to recognize that some people have other more basic needs, whether it's having enough food on the table, having a place to live, and we can't ignore those. Now, as far as addressing health disparities, we have three key steps. We think we need to take specific steps to reduce HIV-related mortality in communities at high risk for HIV infection. The big thing here, I think, is we need to adopt community-level approaches to reduce HIV infection in high-risk communities. And we need to take specific steps to reduce stigma and discrimination faced by people with HIV. Now, to do these things, we actually added a fourth goal to the President's, and that we need to take steps to increase coordination across the federal government, and there's two ideas here. One, we need to really focus on increasing coordination across federal agencies, but also between federal, state, local, tribal, territorial governments. And the second thing is we need to increase the mechanisms to monitor and report on our progress. You know, we've sustained a pretty significant response to HIV for almost 30 years. We spend more than $19 billion. But to keep that investment going, the American people need to understand the challenges we face, understand that we have a good news story to tell, and that's how we're going to keep them invested in supporting us going forward. So that's really it with the stretch. I will just mention that times are tight. There'll never be enough money. You probably heard in response to the ADAP crisis, we did reallocate, reprogram $25 billion. This is not something that's easy to do. So while advocates should push us for more money, and I'm not pushing back against that, please understand that late in the fiscal year, to declare an emergency and reprogram money, taking money away from other worthy programs, is not something we do lightly. And it's because we do see the seriousness of the challenge. We also, though, announced new funding through the Affordable Care Prevention and Public Health Fund for HIV prevention, $30 million for FY 2010. And this is something that I think is very exciting because it's not just new money for HIV prevention, it's all new initiatives that are going to support key goals of the strategy. So just next steps, my office is planning to travel around the country and really help to sustain the momentum that we've generated. The agencies are developing their plans, and you'll be hearing about that as we go forward. But I also think a lot of the action shifts to you and other people. We need to see a lot of things happen at the community level, and we're also going to be reporting to you annually. So I think it's an exciting time. I didn't walk through the metrics, but for each of these areas we set specific metrics that we're going to be monitoring. These aren't things that you can expect to see progress in a year. So we set 5-year goals, but really some of this, to have a meaningful impact, it's going to take time. But I think we feel like we're very excited and feel like not just that we at the federal level have done some important things, we feel like really the community and lots of stakeholders have been really marching towards one shared vision, and we're really excited about that. So with that, I'll say thank you very much.